Gatherings have special meaning in Indian country. For tribal leaders, they offer the opportunity to trade ideas, talk about policy, advise federal agencies, and certainly to share anecdotes and laughter. Recently, leaders Ron Allen, Cindy Nation, Michelle Hicks, and Lynn Malerba met to discuss something near and dear to their hearts and that echoes across Indian country: how to care for elders and those with disabilities long term.
When it comes to long-term care, our program is kind of a makeshift from our housing, our health care, and just a small little program that is designed to provide assistance for our elders. So we combine them together to make it work for our elders. We don't actually have a facility, but we have a very strong housing program. So elders who need housing, who don't already own their own homes, we assist them.
I represent the Doyon region, which is 42 villages. Tana Chiefs Conference provides all the health care and the social programs and those kinds of things. And our program started in 1992 with a small respite grant. We provide home care services because our goal is to keep people at home. The first time I went out into the villages, one of the first times, an elder told me their souls didn't rest unless they were able to die at home. So I've never lost that.
You don't want to send people outside of your community, so that if you don't have a nursing home or that next level of facility to care for someone, you're kind of banishing your elders a little bit. And isn't that just kind of the opposite of the boarding schools? You know, you're sending people out of your community to accept care. Mm-hmm. So I think that is kind of the next evolution in terms of what we need to be thinking about.
I think that's really going to be different for what kind of communities you serve. Mm-hmm. Because in Alaska, we have cities that serve. You know, our tribal city for us is in Fairbanks, mm-hmm. and the services that are provided are to 42 villages that are most of them are only accessible by airplane or boat. And they're from 60 to 500 people. So you can't really provide, have an assisted living home in each community. Mm-hmm. So what you want to do is train up people in that community or really support the family and the whole community in providing services for that elder.
Yeah, I agree with both of you in terms of outreach to the elders to have a better feel for what do you want? Do you want to live at home? Do you want assistance at your home? Or are you interested in a facility that is close to the community activities that are going on within the tribe, whether it's powwows or special cultural events and things like that we might provide, or activities with the youth, which many of our elders love doing. They like to engage with the youth with regard to some of our traditional programs that we have. It can be expressions of the art. We do carving and basket weaving, things like that.
In Indian country, by 2030, there will be almost 3 times as many elders as there were in 2012, and many of them will need programs of long-term services and supports, LTSS, for things like cooking, dressing, medication, and money management. Younger people, too, will need LTSS. Native adults of all ages have the highest rates of chronic disease and disability in the United States. Elders, others with disabilities and their families, prefer services that are delivered in their own homes or in community-based facilities. Native people have a long tradition of meeting their needs. So who better than the tribes themselves to create and operate LTSS programs for their people? Different tribes take different paths when it comes to LTSS, and there are many decisions to make. That is why the Centers for Medicare and Medicaid Services created a technical assistance center especially for tribes. The online site pulls LTSS resources together in one place and offers a roadmap to guide tribes along the way. The first step is to seek input from each unique community.
We've adopted a number of assessment processes, and over the years, it's been very helpful to us to go directly to the elder and ask their opinions about, where do they see the current services. We do an annual report to the people, 15,000 tribal members, and one of the things we ask for is give us feedback on tribal services, again, hospital, nursing home, EMS, whatever it may be. And that's also been a very valuable piece of information gathering. The third piece that I think has been very successful is just community club meetings.
Outreach is critically important to make sure that you know what they want. And not everybody is real vocal, and so you have to put them in an environment that you actually find out what are they thinking.
I think that as we think about long-term care services, it's a value to the whole community, not just to the people who are receiving the services. It also says to that individual that when I do need assistance and I do need help, that my family and my tribe will be there perhaps when it's my turn to need help.
It matters what's in your heart and the passion that you have to provide those services. And you're going to have ups and you're going to have downs. And if you just keep looking at the successes and each elder that you're able to help, you're going to build on top of that and use lots of prayer.
I've always felt that if tribes can benchmark off of each other and improve the foundation that they have and make a better living conditions for their people, then obviously we're doing our jobs. But I'm also encouraged about the future. The tribal systems are improving. Whether it's improving the relationships at the state level, the federal level, making sure that we're utilizing all the partnerships that potentially are out there, which personally I don't think we are. I think there's plenty of opportunity there, but we've got to work harder to find it.
I've watched Indian country grow into what I consider a very impressive success compared to where we were 40 years ago. And that success gives me encouragement. Yes, we have to temper that with that success breeds higher expectations that we are always chasing. But if we are able to reflect back to where we were and where we are today, we're doing a lot of good things for our communities, and elder long-term care is among them.
Caring for our elders and people with disabilities is a growing concern, and it can be difficult. How do we get started? Who can help? Where do we get funding? The Centers for Medicare and Medicaid Services is working with American Indian and Alaska Native communities to help answer some of these questions, to build programs that enable individuals to remain in the communities where they feel safe, are valued, and surrounded by those they love. There's never been a better time. You'll find technical assistance, funding streams, program models, and training opportunities at the LTSS Technical Assistance Center at go.cms.gov/aian-ltss. Visit, explore, and get started today.